Welcome back, everyone, to Predictive Intelligence and Pandemic Preparedness, Theme 4, Human PIP. Um, I thought I'd start off um, just giving a little bit of my idiosyncratic recap of what happened yesterday, and then we're going to hand it over to John, who's going to, sort of give us some of the highlights from the mural sessions yesterday, to try to get us thinking about where we've been, where we're going to go today. So let me just show a few slides here. Oh, actually, I'm sorry. I should have been ready for this. I have to have an auxiliary screen here, and my screen is frozen. All right, now I will share screen. Sorry. Okay. I just want to highlight a couple themes, um, based on our conversations yesterday. Both the panels that we had, the first on culture identity and transmission, and the second one on equity and community engagement. Um, Something that I saw coming up repeatedly, and also in the breakout sessions, was the idea that trust matters. Trust matters for working with communities. Trust matters for ensuring sort of sensible responses to of individuals to epidemic conditions, pandemic conditions. I think a really important idea that kept resurfacing in various conversations was having a presence in communities that's trusted, not just sort of swooping in, listening to people and to people's and to communities' needs. A real challenge for whatever reason. It's the way to get things actually accomplished. Identifying people who can serve as brokers, who are um, trusted individuals within communities, within households, within the academy, within government, right, and working to repair broken trust, from things like, our really sordid history of medical experimentation, right? We need to build bridges with communities to get people to accept vaccination and other types of intervention. So I think that trust is a key component. Um, uh, this is my interpretation of what a lot of people were talking about yesterday, and I think it's related to trust, right? So thinking about when things are uncertain or when they're impossible to negotiate, we might turn to trusted sources like our mothers, right? We might accept the herbal remedies that our mothers are suggesting rather than what the biomedical interventions that are being pushed at us. Um, or we might do what others are doing around us, right? We might engage in some conformist heuristic decision making when faced with a great deal of uncertainty. We might do what other prestigious people are doing. This is another sort of issue of trust. If someone is prestigious in your mind, you're likely to be trusting of them. And I think that this matters enormously for dynamics. We don't have a lot of integration of this sort of modeling in this workshop, which I think is too bad. But here are two examples of work that I've been involved in recently, where the way that people make decisions about their social interactions matter for the dynamics, the transmission dynamics of an infectious disease. On the left is a plot that I know that Paul Smaldino is going to show later in the session on misinformation. And on the right is, and so this results from a group dynamic where you have two groups who are interacting and don't trust one another, and we get this interesting alternation of incidents. as a result of the groups avoiding the protective behavior that's adopted by the other group in a polarized society. On the right-hand side, we have where people are fearful of the current epidemic conditions, but their behavior happens with a lag with respect to what's going on with the epidemic. We can get this pretty wild oscillation that happens. And so thinking about how people make decisions and what drives their behavior under epidemic conditions actually matters a lot for the dynamics and therefore for the eradication and control efforts. I think it's very clear that inequality creates vulnerable landscapes in the United States and globally. We have a ton of inequality, and we saw a number of talks yesterday that addressed this issue. One thing that I think is really important to bear in mind is that these vulnerabilities actually open up powerful mechanisms for intervention. Where you have vulnerability, intervening there, and this is something that Jean Richardson talked about, you actually have the capacity, you have leverage to disproportionately reduce the epidemic if you have the political will and the trust in the community organization to get in there and sort of hit the vulnerable places, right? Because these are systematic things. Actually hitting the weak spots have a disproportionate effect on reducing the overall epidemic. We didn't talk about it a lot, but I think it's really important. Massive unsolved collective action problems. And once again, trust is fundamental to solving collective action problems. People recognize people need to recognize that these are collective action problems, and they're very difficult, particularly in a polarized society like we are experiencing right now. But as Daniel Nettle pointed out, things are not hopeless. People solve collective action problems all the time. We as social science researchers can probably help in nudging people towards the solution of these types of collective action problems. I'm thinking of ideas like Lynn Ostrom's principles for common pool resource management, things like that. Really important, I know Monique Bergerhoff-Mulder is going to talk about this later, open science, transparent government. This is another key element of ensuring trust and fostering trust. With so much misinformation, opening our science and making it as transparent as possible and making our policies for control and prevention as transparent as possible is a fantastic way to ensure trust. And I'll finish off my points by just saying that I think that there are clearly training and funding gaps that are things that we can talk about in the breakout rooms. Talking about barriers to doing the type of research that we need include the alignment of professional incentives and credit for community-based research within academic environments, better funding mechanisms for longitudinal community-focused research, and of course, publishing outlets for interdisciplinary scholarship. I'm going to conclude by just pointing out my colleague, the anthropologist and statistician, I realize that's a pretty unusual combination, but he's an unusual guy. Richard McElrath this morning tweeted out his series of cats reacting to COVID models that he actually tweeted back this summer. And the thing about thinking about social behavior is that we can put these into mechanistic models of transmission and control, and we get to avoid things like the red one is the infamous cubic fit. And of course, a cubic fit always, depending on the sign of the first term, it always has to come back down and it'll actually, of course, go negative eventually. But we can avoid both the dreaded cubic fit, but also the IHME models, which were also highly constrained. There's absolutely no human behavior underlying these models. And by studying people's reactions, by studying the behavior, we can build that into our models and for forecasting, for prediction, for control, and do better science. So I'm going to turn it over to John now. Looking forward to the rest of the day and the great sessions that we have lined up.
Thank you, Jamie. So hopefully by now, most of you are very acquainted with Mural, and you'll be in Mural again today in the breakout sessions. And just wanted to voice that the stickies you create really matter. Our facilitators are going to be collectively organizing this, theming, and that'll be exports for Jamie and everyone else behind this effort to leverage your own taxonomy, your own stickies in the way you express things. So they really do matter, and we'll be looking through all of them. And I'm just going to surface a few. This is not me picking favorites. This is just me showing the diversity of thought. So on yesterday's first topic, here at the bottom of the exercise, what are the training gaps and how can we fill them? For example, this sticky here says disciplines are still siloed and integrative cutting edge approaches are needed, such as engineers having social science training in addition to traditional training. There was different groupings. So aside from stickies, topics like demonstration, collaboration, and funding, which Jamie just mentioned, were organically surfacing in some of these prompts. And then on our second topic, under barriers, we saw topics like cultural differences, racism, judgment and perceptions, time and budget. And then in terms of opportunities, there's research-based opportunities, community, both on the education and engagement front, as well as inform. And I like, there's very verbose stickies, which is totally fine if you have a lot to say, but there's also beauty in simple. So more perspectives equals better research. It's like thumbs up to that. And so, yeah, we've got a lot of these murals, 5 separate ones today. And there is a slight difference I wanna set context to. So yesterday, if you remember the rather rapid experience of, we had solo work followed by grouping and socialization, then another prompt, then another prompt. We're actually going to be changing that up to make more room for discussion. So rather than 3 separate sessions of creating stickies, we're just going to have one. So you'll have some quiet time to generate stickies on any of these 3 vectors of facilitator, barriers, or opportunities. You'll be able to create stickies in whichever topic or topics that are interesting to you. And then we'll spend the majority of the breakout just having discussion. And within that discussion, maybe creating some new stickies and some categories and themes. So there is a slight tweak in the facilitation experience, and just wanted to set that context. With that, we'll have the separate Zoom link for you when it's time for breakouts. Other than that, I'd say proactively take notes so that you can bring some interesting ideas to the breakouts today. And with that, thank you in advance from our facilitators for participating. And I think Vivek, you're up next for getting us ready for our next topic.
Yes, thank you, John. Hello, everyone. So I'll be moderating the next session, which is on information, communication, and misinformation. We have an amazing lineup of speakers. We'll have 4 speakers who will be giving talks, or I should call them vision statements. And then we'll have some moderated discussion as well as some Q&As. After that, we will go into the breakout sessions, which again, I guess you are all familiar with that now. So to start off the session, I am taking a clue from what Jamie did. So I'll share my 2 cents on this topic, and then we'll start with the presentations from the different experts that we have. And those 2 cents are very, very simple. First one is great science needs great communication. So we need good research on identifying the right vaccines. We need great research on identifying non-pharmaceutical interventions like masks and distancing. But unless they are communicated properly, it's the human factors which can make or break our response to pandemics. And this is something which came up again and again, and will keep showing up in different discussions that we will have today. The second key point, which I realized, was that there is a need to critically examine the implications of different health information systems. So one example was that if elderly folks are one of the vulnerable populations for vaccination, we want to prioritize them. We shouldn't have information systems which require people to go to 7 different browsers and safaris and whatnot to figure out how to get the vaccination slots. That is going to leave people behind, and those are exactly the kind of people that should not be left behind. In my own work, together with Professor Pamela Valera, we've seen how search results work in different languages. Specifically, we found that autocompletes work very differently in English and Spanish. And you could be searching for the same kind of health information, things like what is the impact of hand sanitizers. And if the results look very different, if the autocompletes look very different in English and Spanish, then there would be very different downstream outcomes for different sections of the society. So again, there is a need not just to design health information systems, but to think ahead, to critically examine what would be the downstream effects of different decisions taken. With that, I would pass it on to this extremely knowledgeable array of speakers that we have today. Starting us off would be David Lazar. He's a professor of political science and computer science. He is a unique person with this very multi-dimensional perspective. He'll be providing an anchor talk. He would have about 15 minutes to summarize his talk, which he has already shared with us on YouTube, but also give like call to action, things that we as a research community should be thinking about. After that, we'll have 5-minute vision statements from 3 other experts, Professor Kimberly Prather, who is from UC San Diego, Professor Emily Brunson from Texas State, and Professor Paul Smaldino, who is from UC Merced. So without any further ado, let me pass it on to Professor David Lazar. David, if you would share your screen and lead us.
Thank you, Vivek. I'm just going to talk, so you don't need to see my screen. This is sort of, well, I'd say it's old school, but not really.
Perfect, perfect.
And first, I just want to thank you for the invitation and for organizing such a valuable event and discussion. So I know how hard and time consuming these things are, but they're really necessary to move us forward. And I do think we're in a particular moment where it's very helpful to have these conversations. So I'm gonna talk about 3 things. I'm gonna give a brief, first, a brief summary of my talk that I gave. Second, I'm going to actually offer a critique of my talk. And then third, motivated by that critique, I'm gonna offer some vision about what we need, what I see that we need as a scientific community in these spaces. So let me briefly summarize my talk. That's somewhere on YouTube with a lot of other things on YouTube. In our talk, in my talk, I was presenting what was mainly a paper that was published that I had in a few years ago on the prevalence and sharing patterns of fake news on Twitter. The objective of that research was to look at the prevalence, sharing patterns, and attention patterns to fake news, and I'll put quotes around that, on Twitter during the 2016 election, because there had been a lot of discussion around the role of misinformation and fake news, but not a lot of really hard data on that. So what we were interested in is what actually actual humans were seeing on Twitter and doing on Twitter. And so we began with the problem of how do we identify a large sample of actual people on Twitter versus tweets, say, or some sample of tweets, which will contain lots of non-humans and also be an odd sample of human behavior. And so what we did was we took, we matched voter handle data Twitter handle data to voter data. So voter data in the US are semi-public. They're messy to work with, but there are some vendors who curate them nicely, and we were able to get the cooperation of a vendor. So we were able to build the sample of around 16,000 individuals where we knew a lot about them because of the linked administrative data. We knew partisanship, gender, age, and the like. We could then also, for those people, identify who they were following, we couldn't actually see what they were seeing, but we were able to simulate their newsfeed or a sample of their newsfeed by looking at who they followed and then getting all the data from the Decahose we had at the time. We had Twitter way back in its early days had given access to Northeastern free access to the Decahose, which is a 10% sample of Twitter. So we were able to take our Decahose data and simulate the news feed for the 16,000 people that we had identified. And then the final thing we did was we developed a curated list of repeat sources of misinformation on the internet that in particular had pretense to look like real news, but really weren't. And that's what we were operationalizing as fake news. We were relying heavily on fact-checking websites for that. And so there, what we have is a set of 16,000 people, quite diverse. We actually have a paper coming out in Public Opinion Quarterly looking at some of the biases that result from our matching methods and so on. But we did reasonably well in terms of the diversity of the sample. We simulated their news feed. We could see what they were doing. And then the question was, how much of what they were seeing was quote unquote fake news in terms of the 2016 election? How much of what they were sharing was fake news and misinformation? And so what we found very briefly was that on the one hand, there was substantial amount of misinformation around the 2016 election floating around. Let's say 5% of what people saw was from about the 2016 election was from what we called fake news sites. But in fact, that was concentrated. That's a misleading statistic. It was concentrated almost entirely among a very small number of people. Around 1% of people accounted for the large majority of exposure. And then on sharing, we found even more concentration. 16 people out of the 16,000 accounted for almost all of the fake news being shared in our sample, so 0.1%. And also we looked at, we could look at, what was your probability of resharing content, and we found people seemed to, contingent on potentially being in their newsfeed, were more likely liberals shared liberal content, conservative content, but whether it was fake or non-fake didn't seem to matter much. And there are obviously nuances to that. And then we also had a big picture of how it all fit together in the broader news ecosystem. Turns out that all the fake news stuff was co-consumed by a very tiny number of people, lots of websites, but consumed by a small number of people. So this was a very distinct niche within Twitter. So that's what we found, and we also have some updates in terms of 2020 and COVID-19. So that's in the talk, and they're actually very similar patterns. And in terms of bots, basically none were bots because of our both because of our matching process, but then we said, well, maybe some bots slipped in there. But these had substantial online presences. So if they were bots, they were very fancy bots. So I'm pretty sure that they were real people. So that's what we found. I think that was I think that was a fine paper, fine research. But I'm gonna now critique it. And in the critique, the point here isn't so much to tear down my paper, because I think it's a nice paper, but to point to like what we need as a research community. So here are the elements of my critique of the paper. First of all, it was very expensive. This is probably the most expensive paper I ever wrote. And by expense, I mean both the quantifiable expenses and then the things that we effectively had subsidized. So it was the bulk of the work of 4 postdocs for a year, right? That's really expensive in terms of effort. It required access to expensive data that we were lucky to negotiate essentially for free. So the Decahose, voter data. Like I said, even the voter data are sort of in principle free. To have national access to national voter data is actually, it's an expensive curated thing, and we were able to work with a vendor who gave us access to very expensive data for free. So number one, it was very expensive. Number two, it had important compromises. So for example, we don't know what people actually saw on Twitter. We had this sort of simulated news feed. Here's the decos, here's who you follow. We can come up with point estimates of how much of what you saw might have seen was fake news. But of course, what you could have seen, what you do see on the internet, very different. And so we don't know what Twitter was doing in terms of curating your news feed. And so that then has important ripple effects. Like when we talk about people were more likely to share consonant information, that's almost certainly true, but we don't know if Twitter was more likely to show them consonant information, liberals, liberal content, conservatives, conservative content. And so that would inevitably bias our estimates on resharing patterns. And we have no idea what people saw and did not reshare. So there are a number of important compromises along those lines. Third critique was that it was a single platform, right? Twitter, and of course, there's a disproportionate amount of attention to Twitter. And I think Twitter is important. So I'm not going to apologize for studying Twitter. But in fact, we know that people, Twitter is very important for the public conversation, and we've seen that, right? But it doesn't have as many eyeballs for as many hours as Facebook or Instagram or YouTube, and it certainly doesn't play nearly as important a role in terms of routing people to information as Google. So as these information giants of the 21st century go, Twitter is actually fairly lower on the list, but it's also a lot more accessible. So I think it's important, it's accessible, it's worthy of study, but it's only a single platform. It's the most studied platform. And not only that, but what's understudied, vastly understudied, is multiple platforms, because we know one of the things we found in other research is that Google was including tweets as part of their search results for certain periods of time, and we could see how, for example, Google was likely amplifying Donald Trump's tweets because it was just necessarily, its algorithm was necessarily pushing Trump's tweets to the top about any issue, and so when it showed tweets, it would vastly disproportionately show Trump's tweets. But that's outside of the Twitter platform. But then it could be that the Google tail is wagging the Twitter a dog in this case. So there's a lot of things happening between platforms that we don't see. Third critique was that has limited replicability, right? We make our data, we make aggregate forms of our data available, but there are ethical and privacy issues around, and as well as legal issues actually about sharing the raw data. And then the final point, it was really too late. We published this paper in 2019, right? The barn had burned, the horses had, died of old age or whatever. I mean, it was like years later. It was much too late to really inform the moment. So all this isn't to say that we should discard this paper. Like, I think it's a really good paper. In fact, it's a really good paper in part because of the challenges and because we had to work to overcome them. But they do highlight now the third part of what I want to talk about, which is what we need for our research going forward, and what we need collectively. I would argue that we need a shared or multiple shared platforms for social science research that could be readily available to deal with issues of the moment, like COVID-19. And indeed, one of the reasons why we were able to do the COVID-19 stuff that I talked about at the end of the presentation is because we had built, not only did we build this for the 2016 research, but we're like, boy, that was hard. but it's actually a lot easier to maintain. And not only that, but we scaled it up quite a bit, 100-fold. And in part with the NSF support, if you go to COVID states.org, you can see some Twitter dashboards that we've built, so you can look at what information is being shared about COVID on Twitter, and we have that up to date as of I'll have to double check, but in principle, we can have that up to date up to a week or two later. And so that's real time. But again, it's just Twitter, and it's just for certain things. We need the shared platform that's quickly ready, that needs to be independent of industry giants. I'm in part of some efforts that involves working with companies. There's this big effort that Josh Tucker and Talia Stroud are leading with doing this pre-registered research on Facebook's impact on the 2020 election. I think that's really important. It's really valuable, but we really need infrastructures independent of the platforms, because they have a dog in this fight as a general principle. And we need, there needs to be part of the objective really needs to be about accountability. It would be like having air quality detectors out there in the world to know what the air quality is, but we don't want the polluters being the ones who maintain the access to the detection of air quality. Third point is that this platform needs to study multiple online platforms. So it needs to include Facebook and Google and Twitter, and work with multiple hardware platforms, because we see this increasing transition from desktop to mobile, right? And they pose different technical challenges in terms of monitoring behaviors and different possibilities. But we will need to actually look at multiple hardware platforms, but we also need to look at the intersection of these online platforms and how they play with each other, because it does turn out that there are definitely problems that happens at the intersections of platforms that I think almost all of our research is missing. Fourth point is it needs to study attention. I think that very little research on the internet today is actually focusing on what people are attending to. We should view the internet as this vast cognitive psychology experiment that we're all subjects in. And yet we don't have data on what people are actually seeing, right? When most of the research on Twitter, for example, is looking at sharing behavior, right? Because the API, what's accessible is what people are doing in terms of writing and sharing, but not what they're seeing. We're not generally seeing what people are seeing on the platform. Twitter knows that, but we can't. And so we need to understand and be able to study human attention. And then we also need to be able to study algorithms. We need some way of archiving the dynamic internet. Like the static internet, there are various efforts to capture. Some have strengths and weaknesses, but there's almost no efforts to capture the dynamic internet. So like if we wanted to say, what would we find if we searched for coronavirus 3 years ago on Google? There's really no way to reconstruct that. Like there's no archived version of Google, right? There may be archived versions of the CDC website. There are archived web versions, but there is no archived version of the dynamic internet. And to find what the algorithms are doing, that is, all right, we're not going to get the code from Google, but we can certainly understand and look at what Google is doing at any given point in time. So how do we archive that for research? So we need to be able to study the algorithmic component. Scientifically, it needs to be a large sample, and it needs to have viable niches, oversamples of certain kinds of groups, whether we're talking, I think social science in general has had a majoritarian bias because it tends to focus at the middle of the distribution and think about how do we have viable samples, and that inevitably, among other kinds of things, focusing on the middle of the distribution ends up focusing on majorities and missing what happens in minorities. And I'm not saying this is like all social science research, but too much of it, right? In part, that's just because it's more cost effective. It's easier to say, let's focus on the middle of the distribution. But I think one of the rules on the internet is that the median behavior is on the distant tail of the distribution of people. Like when I was talking about fake news, the median behavior of sharing fake news is out in the 0.1% of the distribution. So like we can't study those super shares of fake news based on a sample size of 16,000 people because we only get 16 people. We can't do anything statistically robust with 16 people. So we need to think about how we create something that has, it's both a large sample, but also with different oversamples of different niches. This platform needs to be bulletproof in terms of security and privacy preservation, and yet it needs also to somehow offer broad access, and that's a tough one, right? I don't think it's impossible. I think there have been various efforts out there in different domains to do this kind of thing, but we need that combination of security, privacy preserving, and data sharing. And really data sharing be just analytic access. I think part of the answer is you don't actually share data, you share access for analysis. And the final point is that we need the public policies to support the building of such a platform. So for example, part of this is we need investments of resources, but the other part is sort of legal frameworks that, for example, offer kinds of exceptions for research that preempt efforts by the internet giants to shut down data collection. So for example, NYU had an effort around collecting political ads from Facebook, and Facebook issued a cease and desist order that was quite damaging. And so so in any case, I think that I think that we need resources, but also certain kinds of legislative protections for the kinds of research that needs to be done. And honestly, ultimately, even though I think some of these internet giants will squirm at this, I also think that they'll be better served ultimately if we don't just expect the worst of them. I think that transparency, if you're behaving well, transparency is actually a good thing. And so what we really want is a world where what the internet giants is transparent and they're also being good actors. And what we have now is opacity and suspicion that they're not behaving well all the time. So I think that's just a bad equilibrium we're in. So I'm going to stop there. That's my vision for what it's worth. I hope you, despite my critique, you'll still read our paper. But in any case, thanks for listening patiently. And oh my gosh, I see. I answered that one question, but I see lots more things popping up. But in any case, I'll stop there.
Thank you so much, David. Lots of questions, lot more discussion, but we will move on to our other presenters. So first up, we'll have Professor Kimberly Prather. And please, Kimberly, take it away, and please let me know when I need to move slides.
Okay, well, thank you. Thanks for the invitation to be here. I'm actually learning a lot about sort of a different side of things than you'll see I spend time thinking on. So I can't wait to get the input from people that are at this workshop on this topic, which I'm going to talk about today, which is just getting at sort of a lot of misinformation that has surrounded how people become infected with COVID-19. So I'm a professor at UC San Diego. I run a National Science Foundation Center called CASE, which focuses on aerosols, more on climate. But I've been pulled into this over the last roughly year from a science communication perspective. And it's been a wild year, and I'll give you just a glimpse of that. And hopefully by the end, we can talk about just how do we not do this again. So thinking about respiratory disease, what we know, thank you, that was perfect. The possible transmission routes. Basically, you know, we think about things as, for some reason, is it gone? Looks like it lost my words. Can you click one more, please? Okay, let's just go here. Okay, I'll just say quickly, there's sort of two ways that you can get these, you know, viruses. One is through touch, contact. The other is through big droplets, which has been a very large focus. And the other is through aerosols. And as I mentioned, aerosols is sort of has become a very popular word over the past year. And it's been as a big push to sort of change more or less a greater than 100-year-old medical paradigm. So if you go to the next slide, please. The focus traditionally has been on surfaces. So if you remember at the very beginning, everything was about cleaning surfaces. People still think surfaces is the answer. I will just say up front in a simple SciComm message, it's in the air. We get it through inhalation, mostly through inhalation of aerosols. But the focus we've been trying to shift away from is everybody thinks about coughs and sneezes. That's been the historical view in the medical community. So when you cough or you sneeze, gigantic droplets can come out, the spray. That's been the focus because that's what people were able to measure 100 years ago. But in fact, you know, and actually there was hints that the aerosols were there, but they've been largely ignored. And we've only protected workers from aerosols if they were in situations of what we call aerosol generating procedures in the medical community. We've learned through this pandemic that aerosol generating procedures generate less aerosols than a person who's infected just simply speaking. So the way this virus in a nutshell has snuck around the globe, one of its sneaky tactics is that it gets around just from people talking that don't know they're sick. So people, before they have symptoms or without symptoms, they're out, they're talking. You generate thousands of aerosols that can be enriched in this virus if you're sick. And these in a closed space in a room with poor ventilation can actually build up like cigarette smoke. They don't fall to the ground within 6 feet. 6 feet is nothing to an aerosol. They can build up in a room and exist for hours. So next slide, please. So this basically early messaging, you know, they came out in February. This is the director, WHO director said it's airborne. You can click again, please. But then this was February 2020, March of 2020. They came out and said, WHO said, fact check, it is not airborne. Just boom, not airborne. No real reason, just airborne has certain meanings. We were told masks work, first we were told they don't work, then we were told they do work, then, you know, they live on surfaces and we must clean surfaces. There's been so much misinformation around this pretty simple, you know, topic to me and to those of us who do aerosol science. And so a bunch of us have been involved largely on Twitter, trying to send this message. It's ramped up to where I connected with Fauci. We've sent a letter to Biden, CDC. We've been pushing from all aspects, trying to get the right message out for the public and actually, quite honestly, regain, as was discussed yesterday, the trust of the public. They don't know who to believe anymore. Next slide, please. So, you know, they say this is just from March of 2020. They say coronavirus isn't airborne, but it's definitely borne by air. This has been the conundrum. I've been flat out told I cannot use the word airborne, but I do. So next slide, please. So this is the sort of paradigm shift that has happened and is happening. We're not quite there yet because we haven't got CDC and WHO to make a clear statement. We're pushing still really hard. But basically, the way you get infected with this virus is inhaling aerosols up close, largely because it's most concentrated next to the source. But as I mentioned, it can also build up in the room, as these little red dots show, if you don't have proper ventilation. So this has been a big change for this virus. Looking back, we actually realize it probably applies to a lot of previous viruses. So this is going to change our way we handle disease in the future. Next slide. So there needs to be a shift, and this is what I'm working on, helping lots of schools, lots of businesses reopen, from cleaning surfaces to cleaning the air. We call it hygiene theater. It makes you feel good to wipe down these surfaces, but it's a waste of time and energy largely. You still should wash your hands, you still should make sure surfaces are clean, but we really need to focus on cleaning the air. Once we acknowledge that this virus is in the air, we can fix it. This is what's so frustrating for me and the other scientists who study this. It is such a fixable problem. We have just been stuck, and it's been really, really painful, to be quite honest. Next slide. Whoops. So why is it important? This just gets back to, it's one thing. So now where we are with like CDC, they're saying ventilation is important. WHO says ventilation is important, but they don't tell the public why. People will make, I'm preaching to the choir here, but people will make better choices if they understand why. That is, basically there's a cohort of us that have been, sort of helping the public understand. They don't get afraid, which is what we were told would happen. They actually appreciate the clarity and understanding why they wear a mask or why ventilation and filtration is important. And so just if you look at the places like Japan, Taiwan, South Korea, that recognized it was in the air because they had the experience from SARS-1, which was also airborne, they basically knew right away to avoid what they call the 3 Cs, closed, crowded, and close contact places. And you can see the data that shows that EU and United States, which did not embrace the air, didn't do so well, but the other places that embraced the air and treated it right up front did much better. And so, the bottom line, things like, there is no safe social distance indoors. It's like cigarette smoke, as I say. It's a reason why we should not be opening bars and restaurants before schools. There's all these sort of just smarter things we could do from the standpoint of reopening and getting our society back going again. And finally, we just sent a letter, as I mentioned about a month ago, to the Biden administration, CDC, and Fauci, trying to get better protection for people who are in high risk situations, lots of jobs, not just healthcare, but to make sure that they're wearing the proper masks and basically properly protected. Okay, next slide. The other reason that we want to make people understand is because it tells us what to do and why we do what we do, but it also tells us what not to do. And so this is my last slide to just say that, it drives me crazy, drives all of us crazy when we watch the speaker go up to a microphone, take off their mask and start talking. When you speak, the number increase. When you yell, it gets even higher. When you sing, it gets even higher. And so, these things just become obvious once you understand the mechanism that's actually leading to the transmission and the infection. You also learn why face shields alone without a mask underneath is not a good idea. It actually sucks aerosols in. Aerosols could care less about plexiglass barriers. In fact, the plexiglass barriers can exacerbate the problem and concentrate things down in the breathing zone where people are, which is not good. And so, all of this stuff just sort of starts to make sense. And I guess moving forward, which was one of the things we were asked to address, is that, this is my last slide. Moving forward, we need to just use this. This is huge. If we can put the infrastructure into schools, give healthy air in schools to kids who a lot of times don't have it, talk about sort of working on inequities. This is a big one, and that we could give kids the freshest air in schools. There's simple ways to do it. This little sensor that I have, this is a CO2. I don't know if you can see it. My thing messes it up. But anyway, it's such a fixable problem, and we can make the overall indoor air quality healthier, and it's drawn attention to it. I think it's really going to help with cognitive issues in schools and everything else. So I think we can turn this into a silver lining, but we still aren't quite there yet. We're still waiting for our public health officials to come through with a clearer message that helps the public, and I'll stop there.
Thank you so much, Kimberly. Next up, we have Professor Emily Brunson from Texas State University.
Thank you. It's a pleasure to be with you today. So I'm an anthropologist. My long-term research has actually been about vaccination and vaccination decision-making. I've also studied healthcare access and decision-making, decisions that people make when they don't have access to healthcare, and then pandemic preparedness and communication in emergency situations. So next slide. Last March, as we all know, COVID-19 vaccines began to be developed in earnest. Social scientists, including anthropologists, however, were not heavily involved in this process. Now, of course, vaccine development itself is a technical endeavor that involves steps like creating weakened or inactivated forms of a pathogen, developing an appropriate mix of adjuvants and antigens, and testing the new vaccine through a series of clinical trials. Vaccination, however, depends on people, and particularly on people being able and willing to accept vaccines. As people experts, anthropologists and other social scientists could have and should have been involved, but they were not, and that led to some interesting and poor choices, including the name Operation Warp Speed. I've heard from members of the task force who developed this name. While they now appreciate it was perhaps not the best choice, they also explain this away by saying, who knew? And my response to that is that social scientists knew. They knew this was a bad idea the moment they heard the name. One of the major reasons that members of the public rejected H1N1 vaccines back in 2009 was because they felt that vaccine had been rushed and was consequently unsafe. People don't want to associate speed, let alone warp speed, with things that they're asked to put in their bodies. Now, I could go on with additional examples, but instead I'd like to move on to some of the work that myself and my colleagues as social scientists have been involved with to address the issue of COVID-19 vaccination. So next slide, please. So recognizing that the uptake of COVID-19 vaccines would be a significant but likely overlooked issue, my colleague Monica Shak-Spana and I applied for a small research grant through the NSF-funded Converge program last April. Our goal was to provide recommendations that could be used to enable COVID-19 vaccination across the US. The working group released a report last July that made 6 concrete suggestions, including that we make vaccines available in safe, familiar, and convenient places, and that we communicate in meaningful, relevant, and personal terms. Of course, doing either of these presupposes that we understand what convenient looks like in different areas, what matters to different cultural groups, and how communication can occur within communities in ways that actually reach community members. In other words, it requires foundational social science research. Recognizing this, we provided another wraparound recommendation that social science research into the area of vaccination be valued and funded. Funding, though, is hard to come by for this work, and I found that out throughout my career. In the case of COVID-19 vaccination, although $10 billion was allocated at that time for Operation Warp Speed, none of that was earmarked for social science. More problematically, once again, is the long-standing funding gap for this type of research that exists across federal funding agencies. At the NSF in particular, this type of work is often considered applied. And because it is not basic science, it is absolutely unfundable. And that has prevented a lot of work that could have been done in preparation for where we're at now, that could have made us in a better position than where we ended up at. So despite the potential funding barrier to our ongoing work in this area, my colleagues and I spent the next 3 to 4 months socializing the report. We presented before Senate committees, provided briefs to members of Congress, reached out to the National Governors Association and the US Conference of Mayors. We gave presentations to the NIH and the national academies. We spoke at conferences for nurses, pharmacists, and journalists. We provided copies of the report to organizations like AIM, NACCHO, and ASTO. And we had meetings with business leaders and private foundations. And this process ultimately led to the next iteration of our work, CommuniVax. So next slide, please. The purpose of CommuniVax, which has been funded by the Chan Zuckerberg Initiative, is to enable an equitable and effective COVID-19 vaccination rollout. The project involves 6 local teams conducting rapid ethnographic work in Black and Hispanic communities across the US. In addition to this research, these local teams are also building community relationships and strengthening local capacities so that these local communities with whom they are working are not only able to affect COVID-19 vaccine uptake, but also create lasting change in their local areas. CommuniVax also includes a central working group that is using data collected by the local teams and through other mechanisms to provide national level guidance. Our first report, the cover of which you can see on the right of this slide, was released last month. So how does all of this relate to information, misinformation, communication? These are all issues that I and my colleagues have considered since the beginning. And we've provided specific recommendations like the 2 I presented on the previous slide. Communication and especially sharing information, like Kimberly just suggested about how COVID is spread, is very important. It's also critical, though, to recognize that communication represents only a part of the factors that can influence or affect vaccine uptake. When we're talking about equity and true equity for marginalized groups, for racial and ethnic minority populations, we need to think about trust and trust within the system, not necessarily vaccines themselves, which is more than just a communication effort. as well as access issues that, no communication effort can overcome. Somebody can't actually get the vaccine. So my time is up, but I'll be happy to answer questions about this later on.
Thank you so much, Emily. Next up, we have Professor Paul Smaldino.
Sorry, I was muted. No, I'm not. Hello. Yeah, so was trying to do as sort of as forward-looking a talk as I could. And it seems like, the main concern with communication and disinformation and things like that is how, sort of pithily to put it, how to get people to just listen to reason for once, for crying out loud. So next slide, please. I think we can ask this, and yeah, if for all the slides, you can just advance them to the for all the text. So the main question is, why do people believe demonstrably wrong things? And you can qualify that with, what is wrong or right mean in some context, but I'm going to skirt past that. And I think there are three reasons, sort of categories of reasons. One is they don't know they're wrong, they don't care they're wrong, or their worldview is incompatible with what you think is the truth. So next slide. So let me break these down a little bit. So I think one of the things we focus on the most is that they don't know they're wrong. So maybe they believe misinformation or disinformation. There's a lot of reasons why this might be the case. One is that the skew of information they get is not sort of uniform, right? They're getting skewed distribution of information. There are online filter bubbles, there are echo chambers. We have an extremely polarized news media that are incentivized to keep people polarized. People like sharing things online, et cetera. And maybe they've just failed to be convinced by the evidence. They just don't believe it because they don't trust the sources. Next slide. They also just may not care if they're wrong, right? Next slide, please. Yeah, there's Robert Mitchum and Out of the Past for you film buffs. So coalitional alignment or values might be important than being right. So there seems to be some evidence that people share at least some of the things that they share online, not because they want to spread information to people to say, hey, I found this out, it's really important, people need to learn this. But instead, they're communicating something about themselves. They're saying, I am the kind of person for which this kind of thing is a view that I would support. Whether or not it's actually true, I want to use this to tell you about myself. A lot of communication isn't really about conveying knowledge to people, but it's about coalition building. It's about identity signaling and things like that. People care about different aspects of things they're with at different times. So whether or not someone believes something is going to depend a lot on the context. I think a lot of us can relate to a kind of situation where we're really willing to go to bat for something if we're in a group of people that are also willing to go to bat for that thing, or sort of close to being convinced, and we may suppress information in other contexts. So like people like Timur Kuran have written a lot about sort of the difference between private views and public opinions. Next slide. And then I think this is an overlooked point often, right? That someone's worldview might just be incompatible with your view of truth. So our understanding of the world, and now I'm sort of wearing my cognitive science hat, is rooted in the analogies, metaphors, and narratives we construct, both individually and culturally. So information transfer really requires common ground. It's really hard to get someone to believe something if they just don't even start with the basic information. So like, if you want to tell someone that vaccines are effective and they don't understand how vaccines work or how cells work or the germ theory of disease, that's going to be a problem, right? You can't teach evolutionary theory to someone whose starting point is that the world is 6,000 years old and all the events that happen are the dictates of a vengeful God, right? You have to start with, okay, can we both agree that the world is very, very old? Now we can move forward and talk about selection pressures. there's a lot of factors in here about the way people spread information more generally. So people have mental models for how the world works. And if you tell them things that can't be easily mapped onto those models, they're not going to encode it. Next slide. I think that all these factors are tied into something which has become increasingly a focus of my own work, which is identity signaling, because all these are focused on the social structure of information flow, who we interact with, and who we see is on our side. And so this is something that Jamie mentioned, right? Under uncertainty, and this is definitely an uncertain time, there are adaptive social learning strategies, right? We can't figure out everything ourselves. We need to rely on other information, but all sources of information are not equal to us, right? We follow what other people are doing, so conformity, or what successful people are doing, or prestigious people are doing. But who counts as prestigious, or even who counts as one of me, like someone like me who I'm going to listen to, is going to depend, is going to vary for different people. So let's say some behavior starts in one community and it's adopted through the normal means like conformity or prestige bias. If it just by chance becomes associated with one group, it can become a marker of identity. And once behavior becomes a marker of group membership, people who don't identify with that group may resist adopting it. So next slide. So we've seen this happen with masks, right? Masks shouldn't be politicized, but they became politicized. And this really matters for disease transmission, right? There's no good reason why masks should be adopted more by Democrats than Republicans. But because they sort of became a marker of a certain kind of person, right, it becomes beholden to people to not do that if they want to identify publicly as a different kind of person. So Jamie Jones and I have done this modeling paper, which is now in press at Evolutionary Human Science. And this is just a simple FIR model, assuming that not only that do disease spread, but also that behavior can spread via similar contagious methods. And that the more one group adopts it, the more the other group is likely to not adopt it. And here we can see an example of the disease sort of starting in one community, but actually becoming much, much worse in the other community because of this outgroup aversion. All right, next slide. So I see there's sort of two classes of possible solutions here, right? First, if we can make preventative behavior so obviously beneficial, its adoption becomes common sense. This is really difficult because there's often uncertainty, and how beneficial something is unevenly distributed, right? There's people disagree and say, oh, well, that may be beneficial for you, but it's not beneficial for me. So you need to convince me that I need to do that, not just for you, but for me. And if there's outgroup animosity, that's a problem, right? So the second solution is decrease animosity and the sense of otherness toward outgroups. This is also hugely difficult, right? Humans are naturally groupish. Some outgrouping probably is going to happen even in like a perfect, ideal, harmonious society, especially in a multicultural one like ours. But it's a matter of degree. So maybe we can't completely eliminate either of these things, but how much can we push the needle? Next slide. So what would it take? So here's an image from the Dr. Seuss story, The Zacks, in which two people, or one is going one way, one is going the other way. And if they just moved out of the way of each other, they'd be able to go on with their business, but they refuse to. And so they're just there forever and a whole city comes up around them. I think, as has been mentioned, there's this sort of crisis of trust in the country. In part because we're not one people, we're a population of multitudes, and cosmopolitanism is probably not a stable equilibrium. There's a lot of work that needs to happen about what becomes trustworthy sources and how people trust things. And I think as a lot of people in this group will agree, right? The answer is almost certainly not better tech, although tech is useful. Social science is harder than physical science in terms of solutions, in part because if you come up with a physical science or an engineering solution, a company can build a product and implement it kind of right away. But social science solution usually involves changing behavior, and that is actually really, really difficult. Behavior change is kind of like the great problem, in part because we have social norms and institutions that are specifically evolved to maintain certain behavioral and behavioral patterns. And also, people are going to resist it, and there are ethical concerns. So I think of this as like, I don't have a real solution, but I think of this as one of the most important challenges, not just for social science, but for society as a whole. I know that was a little bit scattered, but I hope there was some useful stuff in there. So thanks.
Thank you so much, Paul. Lots of exciting ideas. I see there's a flurry of activity regarding comments and questions as well. So if Heather and Alex, would you like to suggest some questions that we could discuss?
Sure, we have a lot coming in, so I'll try to be quick and let all the panelists have a chance to answer. So for Dr. Lazar, do we expect fake news sharing dynamics and distributions to be similar for different kinds of material? For example, how well are your political content findings generalizing to public health information? Could that have been avoided if pandemic hadn't been publicized? Or sorry, politicized?
Yeah, so we certainly actually did see remarkably similar patterns of sharing behaviors. We haven't done the whole attention thing because that's much harder. But in terms of sharing patterns, we actually see very similar patterns in terms of sharing COVID-19 information that it's actually not entirely, but substantially coming from the same sources. There are some, there are some special providers of misinformation in vaccines. Like one of the big ones is, as it turns out, that's emerged in our data is there's a website that RFK Jr. has, and that's actually emerged as a substantial source of misinformation on vaccines over the last few months, and it wasn't part of our political distribution system. So I think honestly it was almost inevitable it would get politicized. So I don't think it was a choice that would get politicized. I think there were certain things that unfortunately amplified it in part around our leadership over last year when this got off the ground. I think was not helpful on the politicization thing. But I think that we do see similar concentration, similar super pumping from a very small number of domains and people of the misinformation, COVID-19 related misinformation. And from overlapping sources, although again, there was a special pre-existing anti-vax ecosystem that overlaps but is distinct from the political misinformation system.
Thank you. Okay, so moving on to Dr. Prather. This is a two-part question. The first part is, we are now at one of the most critical turning points with growing vaccinations. How do we continue to convey, quote unquote, there's no safe social distance indoors when schools and universities are setting aside social distance restrictions in classrooms without paying attention to ventilation? Sorry, this is a long question. There's a couple parts to this first question. Also, how do we protect those who cannot be vaccinated or are hesitant to be vaccinated when educational administration is desperate to perform, quote, back to normal and all face-to-face instruction in the fall? That's the first part. I'll let you address that, and we'll see if we have time for the second part. For Dr. Prather.
That was just the first part. Okay, let me see. So let's see. So the first question is sort of how do we deal with, I think, the vaccine, like we've got the vaccines coming, schools aren't quite all doing the same thing. How do we deal with that? I mean, I'm advising lots of schools, including the biggest one in the San Diego area, which they've been really good listening to me. They've gone beyond what CDC says to do, which is fantastic. but I'm still telling them to kind of slow down. We're about ready to open in April. And if you look around, I see us up against is a race of school openings. They're trying to reopen businesses. The variant is coming, which seems like it likes younger people more. So places that have reopened, like in Minnesota and Wisconsin, are having difficulties, as well as other parts of the world. We're in a race, and so I kind of want, personally, I feel like I'm getting rather uncomfortable because I'm sort of tired of Groundhog Day. We keep repeating the same mistakes. We're not learning from others' mistakes as much as we should, in my view. So I'm trying the best I can, knowing that they're going to open, to get them to just open safely, which means low community spread. We have to get the numbers down before you open. And that needs to be the community where that school is, not just this is where the inequities really kick in, because certain areas don't correspond to one massive San Diego County, for example. So get community numbers down, put the proper controls in. We just, a lot of schools couldn't afford to do that. So I feel like that's what we should be doing. People should be doing while they're waiting. There's now money that's just been approved, which could be used to make the school safer. But there's just I am honestly getting kind of nervous. And I literally just wrote a note to the school district this morning saying, am I the only one that's feeling nervous? So I don't know if I answered your question exactly, but it's a tough one. We're in a race. I wish we would slow down, quite honestly, and let the vaccines do their thing. So that leads me to the second part, which is how do we protect people who haven't been vaccinated? And again, that comes back to, we need as many people vaccinated as we can get, and we need time to get those out there. Now they're saying I think it's May in the US. I would prefer that, we didn't start schools, and for sure, the really not wise thing is the nice way I can put it, is what's happening is we keep making choices to open restaurants and bars at the same time as we're trying to open schools, which is just not very bright. It's going to blow up every time. We're going to keep yo-yoing. So look at the places that have been successful, like Taiwan, that don't do that have, done things wisely. They've never shut down, and they've had 7 deaths out of 24 million people. So anyway, I don't know if that answers it. It was a pretty in-depth question. So there's little tidbits in there, hopefully, that are helpful.
Yes, I think it did. And I don't know, sorry, Vivek, do you want to take time for one more quick question?
Yes, one last question, I guess.
Okay, so this is for Dr. Smaldino. And somebody wrote in the chat that agrees that yes, prevention is beneficial, but its benefits are not easy to get buy-in from all constituents. What are your thoughts on mandating preventing behavior, like state mandates of masks, and at all places?
Yeah, I think that's a really fair point, and a really tough one, right? There's a trade-off between, when certain things we just need to happen, and we're not going to get buy-in. We're never going to get 100% buy-in, but we're not even going to get close to the amount of buy-in that we need to some places, maybe fast enough as we want it. So maybe we need certain kinds of mandates. On the other hand, it comes back to the trust thing. If enough people feel like the government is sort of against them, or trying to do, sort of things that are opposed to what they're about, there may be resistance, and that can kind of snowball. And I think that it really comes back to the fact that this is all tied into the larger sort of social structures that we're embedded into. So there's short-term problems and long-term problems here. And in the short term, yeah, we probably do have to, implement certain amounts of mandates, but I think we need to be really careful and cautious, about how many of these we need to implement, and at the same time try to figure out how we can sort of decrease polarization and increase trust as much as we can. And at some point is also probably, there are going to be limits to how much private actors or even private companies can do here. So I'm not sure.
Thank you so much, Paul. Thank you, all the panelists. Thank you, everybody, for the questions. I see there's a lot of activity, lots of thoughts, And maybe this would be a nice segue into our breakout sessions where we'll get to discuss some of these things. So I will pass it on to John.